Hello, today I will present an introduction to hypothyroidism. Hypothyroidism is defined as an underactive thyroid gland. The intended audience for this video is an undergraduate pre-licensure group of nursing students. I hope you find it helpful in your school, work, and care of patients. The thyroid gland is part of the larger endocrine system. You can palpate it if you feel here, just posterior to the larynx on the anterior side of the throat. It feels rather spongy and has wings like a butterfly. Like other elements of the endocrine system, the thyroid secretes powerful hormones that send messages to other parts of the body to enable the initiation, cessation, or regulation of a particular body system or process. In this case, the thyroid regulates the metabolism of the body systems by telling various organs and cells to increase, decrease, or maintain a level of cellular activity. There are 3 learning objectives for this video. First, after viewing the video lecture, the nursing student will be able to classify patients as having hypothyroidism according to lab results and symptoms. This is important to patient care, since the nurse serves as the eyes and ears of the doctors, providing constant direct patient care with immediate access to the latest labs and changes in condition. The second learning objective is that after viewing the video lecture, the nursing student will be able to create and implement a care plan for the patient with hypothyroidism. Understanding how a disorder manifests is essential to meeting the needs of your patient. The third learning objective is that after viewing the video, the nursing student will be able to accurately order, read, and interpret results for clinical labs necessary to diagnosing hypothyroidism. No matter the setting they work in, nurses are vital partners in healthcare, assisting providers and specialists, responding quickly and confidently to a doctor's order for laboratory tests, being able to recognize an abnormal lab and know its significance for the patient, and providing a succinct report to doctors on lab results is crucial. This portion of the endocrine system is made up of a continuous feedback loop in which 3 structures in the body play a role. First, the hypothalamus secretes what's called TRH, or thyroid releasing hormone. The hypothalamus is a portion of the brain in the center of the skull with a variety of functions. One of the most important functions is connecting the nervous system to the endocrine system via the pituitary gland. Once thyroid-releasing hormone is sent to the pituitary gland, tucked just beneath the hypothalamus, the pituitary in turn secretes TSH, or thyroid-stimulating hormone. The TSH is sent to the thyroid, which then produces 2 kinds of thyroid hormones, T3 and T4. These are the chemicals which tell cells in the body to increase or decrease their activity, creating an increase or decrease in metabolism, resulting in increased activity throughout the body. The relationship between the 3 parts of the hypothalamus-pituitary-thyroid axis can be compared to the heating system in your home. The hypothalamus is like your hand, turning the temperature up or down on the thermostat. Then the thermostat sends signals to the furnace to turn on or off, producing heat. Finally, the furnace is parallel to the thyroid gland. It actually produces the heat, or not, depending on the temperature setting. In hypothyroidism, when a person's thyroid is producing too little TSH for the body's condition, the result is symptoms of slowed metabolism, sensitivity to cold, constipation, weak heartbeat, slow reflexes, depression, thinning hair, slow movements, and thought, sluggish reflexes, and even myxedema. Let's take a look at the specific hormones involved in this disorder. You'll remember we said the thyroid gland synthesizes and produces T3, also called thiodothyronine, and T4, known as thyroxine, which will influence the cellular activity of the body, thus increasing or decreasing metabolism. It is the levels of these two hormones that are measured in the lab tests for free T3 and T4 you may see ordered. Most of the hormones produced by the thyroid come in the form of T4, thyroxine. It contains 4 molecules of iodine and a protein. The thyroid is the only place iodine is absorbed in the body. When T4 reaches organs and body tissue, it converts to T3, the active form of the hormone. When levels of T4 drop, it triggers an increase in thyroid-releasing hormone in the hypothalamus, TRH. Thus, the cycle begins again with the 3 parts of the axis. The TSH lab is one of the most commonly ordered blood tests in medicine. If the results are above the normal range of 4.0 milliunits per liter, a patient is considered to have clinical hypothyroidism. The TSH test measures sensitivity to thyroid-stimulating hormone, and results are in inverse proportion to the levels of T3 and T4. Thus, a TSH level that is abnormally high indicates low levels of thyroid hormones. What are some of the causes for thyroid gland malfunctioning? There are many. The most common is a low intake of iodine in the diet, most commonly through iodized salt. Other causes are autoimmune disease, such as Hashimoto's. Additional causes can be benign tumors, cancer, congenital defects, medication side effects, and thyroid surgery, which results in the removal of part or all of the thyroid gland. Please read through the above case study and consider the following questions. What does an elevated TSH indicate? Perhaps in an older woman patient who comes into a hospital. The answer: a high sensitivity to the hormone TSH, thus indicating lower than normal levels of thyroid hormones. It is indicative of hypothyroidism. Would the doctor be expected to prescribe any medicine? If so, what? The doctor will probably prescribe levothyroxine or another synthetic hormone to supplement their natural hormone, thus raising the levels in the body. The medicine is typically given on an empty stomach early in the morning and given daily with labs, rechecked several weeks after starting, and periodically afterward. It's possible for a patient's depression to decrease as a result of the increase in thyroxine levels. A subsequent TSH lab would reflect less sensitivity to and higher levels of the hormone. A head-to-toe physical assessment may reveal some or all of the following: a weak bradycardic heart rate, hypotensive blood pressure, fatigue, depression, unexplained weight gain, intolerance to cold, dry skin, and edema. I hope you found this video helpful and you can apply some of it to your practice.